see a slide that's a definition of some key concepts?
Yes.
Yes.
Okay, so sorry about that.
Could you please?
Oui.
Yeah. Okay.
Perfect. So still moving from
So thank you, Melissa. Wow, that's great. So I have a quiz for you. Could you please tell me which francophone in this slide?
You have to turn the slide.
Yeah, I don't. Okay, now.
Oh, and it. Oh, it's not the same.
Is this? Okay, so we have a bit of
Avancé, la diapo, c'est ça?
Oui. A bit of technical difficulty, but basically here what we're looking is we'll have a slide of different people. Like imagine a group of people. You come to a room, you come to a shopping center or to a meeting, and from that picture. Okay. From that picture, can everybody see a picture now?
Yes.
Okay, so
Yeah.
the question is,
Yeah.
who in this picture is an Ontario Francophone? And I think you're going to find that we could probably guess at the answer,
That's right.
but it's very likely that you are going to agree that everybody in this picture could be and probably is an Ontario Francophone. And I think it's just to reinforce that concept that that it is a much more inclusive definition now than before.
Okay. So.
And the more inclusive definition is that people, this was back in 2009, that the definition of a Francophone includes not just people whose first language is French, but also those whose mother tongue is neither French nor English, but have a particular knowledge of French as an official language. Excuse me, and when we think of the City of Toronto, this is extremely important because I think we heard from Gilles Merchidon today that more than half of the Francophones who are coming to Toronto have French as their official language coming into this country, but it may not be their very first language. They're coming from outside of Canada. And so that's a really, really important inclusive definition that's really changed, again, the demographic makeup of who we consider to be Francophone. So we're trying to challenge some assumptions here and really understand about the population that we really need to focus on.
Thank you. Another quiz for you. What does that mean for you?
The image in front, right?
Yeah, the image in front. The parking, the parking spot, and with a picture, a photo of a disabled person. What does that mean for you?
Dedicated parking spots
Yeah.
for disabled.
Yeah.
Darcy said it's a dedicated parking spot for disabled people. I will agree with that.
Are people writing in the chat box? Are you getting some answers?
Yeah.
What kinds of things are people
Maybe it's
saying?
accessibility. Yeah.
Not yet? If you want to put anything in the chat box, any ideas you have.
Box. So what do you think about this image in front of you?
It's prioritized parking.
Prioritized parking, and someone is writing, I agree with Melissa, accessibility. And okay, that's exactly what it is. It means there is a protected spot for disabled people. And this is exactly what is active offer. Active offer is the client doesn't have to ask for service. It should receive it, it should see it. And we move with a new definition from the regroupement des entités et des réseaux, which is active offer is about a regular and permanent offer of services to the Francophone population. And it's about equity, it's about quality, it's about a service which is linguistically and culturally appropriate. And also, it's about safety of the client. So this is active offer. It's different than the client asking for service. It's about a proactive approach where the client doesn't have to ask for service.
Patrick, it's Suzanne here. I just wanted to say something else about an important point that you mentioned on Friday that I thought was really interesting. If we go back to the image of the symbol for accessible parking, that one, yes, thank you. I think what was really interesting was that Patrick said, we don't know how many people are going to need this parking. We don't say, only if we have 500 cars a day that need this will we offer it. It's offered openly and accessibly as an open, active offer. And I think that's a really, really important point. I didn't want to lose that point because it's something that's very different from how often services are only offered when we know that we have a guaranteed number of clients that will be accessing it. So I just wanted to make that distinction.
Yes, thank you, Suzanne, for this reminder. And it's true, it's about equity. You don't need to, if we have this number approach, we will lose. Because it's not, when you think of having a parking, you just have, you know for a fact that you have to put a spot, you have to have a spot for disabled people. So that's active offer. So you don't have to wait for the client to act, as I said earlier, but you need to offer the service for the client. What about this picture? What do you think about it? What does that mean for you?
The difference of equality versus equity, that different people need different things.
Wow, that's great.
That's very succinct. I like that.
Yeah.
Anybody around the table want to say anything about it?
And the chat box as well. So it's exactly, you see the box are the same size, but the people are different type of, they have different type of height. So what happened in to the left, you can see it's equality, where all people they stand on the same box, but the right image show that the higher leave his box to the one after him, and the two boxes go to the smaller one. So that means the three now can enjoy the game, as that's equity. And it's not about equality only, because if we talk about equality only, we say, okay, nobody need to speak French or any other language. But in terms of equity, we need to be culturally sensitive and linguistic sensitive, and to bring the language. And it's about quality and safety, to repeat Tarsis this morning.
We have a comment from Amanda that says one size
size
does
doesn't.
not fit
I
all.
like it.
That's
Very well, yeah.
That's a very good
Very
expression.
well, because indeed what we want is to be able to evaluate
Exactly.
who needs what.
So active offer also is about patient-centered care. It's all about the patient. The patient should be a VIP. It's to guarantee that the care is tailored to the needs of the patient, and it also improves the quality of care for all patients. The relationship between the patient and the provider is important, and the care needs to be tailored to the needs of the patient.
Okay.
So, Sylvie,
Yes, I think I'll tell you about my little literature
please
review.
tell me.
Okay. So before I give some of the answer that we found when we're reading about report, and also about practice that's being implemented in the field, because it's really important to see these organizations that have developed an expertise at working with people. And some organizations has made reports that are really, really interesting on top of the evidence-based research. I want to ask people to imagine that they are in a foreign country and they have a toothache. They don't speak the language. I don't know if you've ever been in that situation, Patrick, but it's quite, imagine.
Yeah, it's quite
It's quite,
daunting.
yeah, it's aching, and you need a dentist. And then you see that you don't know anything about the language,
my
you cannot
God.
see any
Imagine
dentist.
you're in China.
That's right. Let's imagine China, something totally out of our perception or comprehension. And then while looking for dentists, then somebody said, you say, everybody guide you to a big, strong building, official kind of medical place, and you're so happy you're going to have your care there. But they say, oh, we do have a French, wait, we do have a French service, let me find out. Then you wait, and then they go back and they come back with that little piece of paper, and it says that indeed, there will be a dentist who happens to speak French on Wednesday between 3 and 5, and today is Monday. And you're thinking, do I wait 2 days with my toothache to have a dentist that speaks French? But then at the other hand, you're thinking, will I be able to make myself clear here about what's going on, and would they remove a teeth without me knowing it? So is it worth the wait? And then the person said, well, we're not sure about the training of that person because it's not official, and then it just happened and it's there. And you say, well, how can I know for sure? So you really want to be sure that you're receiving the care, you know where it is, you know what kind of professional you're going to be served with, and you want to know that there is some continuity. And this is what the literature told us. It was all unanimous about, everybody was saying that the services have to be visible and accessible. You have to be able to see it and access it, and I really like your parking lot, your handicap spot in the parking lot, because it's the best image I can think about that. The next one, we talk about client-centered, like all the medical models and all the health institutions now are really focusing on client-centered, and it's the same for French language services. This is what we're looking for. And it talks about the service. How should they be offered? We're looking at a permanent base, quality and professionalism, and finally should be integrated to the organization. So it shouldn't be a little thing on the side that nobody knows about, but should be very obvious that we know what's offered and when is it offered and what is it done. And when we say integrated, I think we have a pet peeve on this, right? Because sometimes people will just say, oh, we'll translate that flyer, or we'll have a person that speaks French on that corner, and then people think it's sufficient, but sometimes it brings more frustration than anything else, because then what the tools and the tools and the expertise that these people need sometimes might not follow just because you have that little corner desk with the French language services. We keep going on the research. What works? Because that's the question. Like, we have the French language services, we're talking of active, offering them on an active level, so therefore making sure that they are there, you know, and able to serve. So we say, if you want to implement the active offer, what does it mean? So everybody talks about the awareness. Interesting enough, they don't say just the awareness of the French people, they say awareness of the English staff to know that there is a French service available now in their organization. Awareness of all the community and the public. And again, our visibility and accessibility is coming back. How to implement, make it visible. And there's different ways, and I know Patrick will touch on this later with some objects, so I'll keep going. And an important part of the organizational capacity. If we want these service of active offer to last, it has to be planned. It's not something we decide to do on Monday morning, or we're just a flyer on the go. We're looking at having a vision. Who are we going to serve here? What kind of service is going to be able, this organization will be able to deliver? We want to have a bilingual intake process. Very important, because this is kind of the cornerstone. If this is not done at the entrance, at the welcoming with hello, bonjour, then you have a lot of chance that the person will speak English, ignoring that you have an amazing French language services program, and that person will not know about it. Finally, addressing staffing issue. You don't have to designate everybody. It's a matter of making rational decisions, what makes sense for the organization, what makes sense for the clientele as well. So deciding which position will be designated and how this process is going to be implemented. To include this in policies and procedure, so that it's something that has a base, it's anchored in the organization management policy, conceptual framework. And finally, not last, part of the communication plan. So when you communicate, when you do annual reports, you want that to be done in both language. When you're promoting a campaign, you want to think about which part we're going to do in French. When you set up a new service, is there a need for Frank? How are we going to address that? So this is what we found, Patrick, in the literature. And it was very interesting because I have a belief that people know about this already. I have a belief that it's not a big surprise. We expect that kind of result because this is what we experiment. And I feel that as a healthcare provider, this is what we want to offer as well. Now, why don't we look at a way for organization to get there? And in that way, I understand that you spend a lot of hours with your brains and your creativity. You're drawing crayons here. And tell us about the active model.
Thank you, Sylvie. Now we are going to see what is the active model. What is inside this model. So,
and can I just point out, Patrick, before you go on, we do have, Melissa, we do have we are on the panel, we have active offer tools, so you can download that. Melissa told us that you have to be patient because it might take some time. And we also have another link, it's called File 2 on our screen at least. It says it's the toolkit. The second file is even larger. It's a toolkit that we'll refer to when we talk about active model.
okay.
So if people want to download that, feel free. You have it on your desktop.
Yeah. Right on your desktop, you can download the model. So you can even take some notes, because we will start by the letter A on this model. What is A mean? Okay, we wanted to have a mnemotechnic tools for people to remember, and we thought that the word active should be a good word to try to have this mnemotechnic. So what is the letter A? The letter A is about assess the situation. What kind of situation? Assess firstly your internal FLS capacity. That would be a good way to start doing active offer. And also, to be able to offer a good quality, high quality service to your community, it should be good also to know your community, to know if your organization has the capacity to offer actively French language services. And a key point is also what is the attitude, what is the commitment of the management of my organization. That's the first step, because without any commitment from the higher level of the organization, there will not be active offer. So the first step would be an assessment. Assess my situation, assess my FLS capacity. The next.
Assess and assess maybe 1 and 2.
Yeah, one of the tools that we can.
The second link.
The second link is about creating a bilingual organizational culture, and you can find in the second link that you have there, you will have some good question, a tool with some question where you can try to understand where you are as an organization and to move from there. So when I was talking about know your situation, this is a map of the Toronto Central LHIN with its limitation, and you can see that there is around more than 50,000 Francophones in the Toronto Central LHIN territory. So you need to know more about your community in order to provide a good quality service to your community. So a few questions to ask. Does my organization have the ability to provide French language services? We already say all those things. Some good resources are there from the entity. The LHIN in your community are some good resources to start with. And we talked already about the moving toward a bilingual organization, which is on your screen. You can download it and you can find other tools that you can use to get started. Some example of best practice. Do you have any example of an organization from you guys who have already did this first step assessment? Do any of you have this experience around the table? Or I know Tarsis in 2012, you did an assessment of your.
Yes, we sent out a survey to all our health service providers, identified, designated, or regardless any funded agency, received a questionnaire, and we received 125 responses from our system.
Nice.
Wow.
Yeah.
And that gives the LHIN an insight of the FLS capacity of most of the health provider within the LHIN.
Yes, we had the total number of human resources and at what level they are assigned to, and we also received those agencies that do not have human resources within their staff, but that are using the medical interpretation through the Toronto Language Service Consortium.
Good. And last year, I know that with SRVO, with the Mississauga Halton LHIN, they realized also FLS capacity assessment with the six access model with more than 10 health service providers. And this evaluation, this assessment, showed that they have more FLS capacity than they thought they had before. So that's a good way to start to know your FLS capacity and how you can do. The next step is clarify, the C. The C is clarify. Clarify what? Clarify what does active offer mean for my organization? What are my legal obligations? Am I designated? Am I identified? Or, as I said earlier, the approach would not only be an approach of a legal approach, it should be also an equity approach. How and where can I start active offer? Because I don't have to do anything myself. I can partner as well to offer service. I can have a list of organizations, Francophone organizations, with which I'm partner to offer actively service in French. Some resources that can be of good help. The French Language Service Act, you can have it. If you download the tool, you can have the link. And to have a better understanding of designation, you can visit the site or the website of the Réseau du Médecin on the north, and also to have a better understanding of the need, impact, and capacity. You can consult also the Health Gov at this resource, and you can have more information about it. That's a great example of an organization which is happen to be Nexus Santé. So I took those pictures last week at the entrance door at Nexus, and it said no service sont disponibles en français ou en anglais, and also in English. Our services are available in French and English. That's a good example of active offer. So from the beginning, at the entrance, at the main door, you see that there is an invitation which shows that, okay, here you can have someone who can speak English with you. You can speak French or English with you.
I was just going to jump in, Suzanne from Health Nexus, just to say that we have been a designated organization here at Health Nexus for about, I think, 15 to 20 years, and it is a process. I think that's a really important message that we want to share, is that it's not something that happens overnight. Developing an active offer of services, as Patrick has said, is something that can be done over time, and it's something that taking that first step is really just making that commitment to wanting to offer French language services. We actually are an officially designated provincial health promotion service provider here in health promotion services as opposed to health care services. At the same time, we have still phased in a lot of our French language service delivery. So now I would say we really do have an active offer of service. Our websites, our messaging, our front door, as Patrick says, our phone systems all are bilingual, and I think anyone who came to use our services would know right away that we have an active offer. But it does take time, and it takes also a lot of commitment and shared vision and leadership from inside, and that's what we've had here. We have a board of directors where we have representation by Francophones on our board of directors. We have an executive director who is not French-speaking, but who is Francophone. And I think that's another important point, is that you don't have to have completely bilingual staff, but you have to have a sense of wanting to make this a priority for the organization. So it is a journey, and we're still on that same journey here at Health Nexus, but I just wanted you to know that it is possible even if you don't have fully bilingual staff. Over time, though, we have hired a number of staff who are bilingual, so it's changing.
Yeah, I can see some people from Manitoba there. I know that they are really advanced in active offer. If at any time, if you want to get in and say something or write something, that would be very appreciated. Thank you. So let's move on. The next step is target. We are now to the Act 3, target, and what we want you to understand and to do is to set realistic goals. And in order to be successful, you don't need to do everything. So just have some targeted intervention that you can do. That simple intervention. That could be hello, bonjour at the beginning, and have a list of staff who can speak French. That's some simple action that you can do. So always take into account your resources and start by your FLS capacity. That's a good way to start. And as Suzanne mentioned, it's a process, it's a journey, it's a long journey. So don't think that you need to do all the things at the first place. No, just start progressively. Some questions. What are my organizational objectives? What strategy, what activity can I put in place? How I can change my organizational structure? We talked earlier about the commitment from the management level. And Suzanne, I like that what you said earlier. You said that you don't need to be Francophone to be a good advocate for active offer. You need to have this mindset that it's important, that it's the way to do it. Okay.
Did you want to take 2 minutes and ask people if they want to answer these questions?
Yes.
This previous question. So do we have anybody on the phone or around the table here that'd like to share with us what are their objectives in terms of an organization, and which activity or strategy they need to put in place to achieve their goal? So anybody wants to share with us where they are at and where they're going and what they think they need to do, so that we can have an idea here and see how does that help to promote? Or you can type us some examples in the chat box as well, and then we can read them. So basically, when we run the model, we find that if we take a bit of time to just connect with the organization where people are at,
and
maybe we can ask people around here.
Our table, St. Michael's Hospital.
It's not St. Michael's
No,
St. Michael's home. Yeah, I'll pop.
Okay, thank you.
You know, as an organization, right now it's me who's interested. You know, it's based on my own personal history and my life in one sense, and what I've witnessed in healthcare over a number of years in terms of the challenge around Francophone services for individuals who require it. And
You know, I guess in part it's that I have the desire, so therefore, and as the executive director, I want to bring it forward within my agency, so we're really at a starting place. I have a staff that doesn't necessarily recognize, you know, one, we have more than 100% capacity in terms of our service volume. It's one of the challenges I think that many community-based agencies encounter on a daily basis. So then to open it up and to broaden that horizon puts a larger pressure upon that capacity to serve and serve effectively. What they're not recognizing in some instances is they're already serving the population. They're just doing it in English, and therefore the individual is not having access to the most appropriate and best quality care. Usually if they're, we deal with emotion, and so therefore if French language is their first language, therefore their language of passion and emotion, they're not able to actually speak to their issues in a manner which is most beneficial to them. So from my perspective, it makes sense for agencies like mine to actually take this on.
Beautiful. So I heard about awareness of the staff. I heard that you have capacity, but you have to need some accessibility, some visibility, and then you can link both. Like if people are aware and then the services are more visible, you can connect a little bit more.
Sure.
So that's neat. So it's like a first strategy could be that connection between the two.
Yeah, and there is Melissa as well. We talk about awareness, but not only for at the organizational bit, but also at the community level as well.
At the community,
At the community level.
Okay.
And there's Amanda writing something, Sophie. Yes, Suzanne.
I was going to try to paraphrase something that Telsis said earlier, but maybe Telsis, you can jump in a minute and just say it better than I will, which is that really this is about providing better care. We're really talking about providing better health care when we think about offering French language services. So one way to change an organizational structure mentality is to try to make a case about what happens when people are not served in their own language or in a language that they understand as an official language. So I think that when we really talk about providing quality care, this is something that can maybe speak to some decision makers within an organization or people who are at that level. Telsis, did you want to add to that? Because I think you said it much more eloquently to me in an earlier conversation we had today.
Oh, thank you very much, Suzanne. Well, what I said, I was louder.
Louder, okay. We want to hear you well.
All right, okay. So what I said is, whenever I think about active offer, I thought about 5 pillars in our care for patients. First of all, it was better communication would trigger better and better health outcomes at the end of the communication between the clinician and the patient. If the communication went well, no second guessing, no nothing, no multiple exam, no second guessing, no second opinion. It's straight the best prescription and the best medication to the patient and better health outcome. One. Secondly, because of that better communication, there was guarantee of a better patient safety and better satisfaction. Patient satisfaction is really the heart of all what we do. At the center of what we do, we put the patient at the center of our interventions. And not doing those double guessing, things like that, brings to better system efficiency, which finally brings better value for our money.
Beautiful.
That's a great summary, and I think in terms of taking those 5 points forward, something we want to be able to communicate more effectively. Thank you, Telsis.
Yeah, and that there is something I don't know.
Yes, sure. Basically, we're seeing that, Amanda, you bring a very interesting point that you're in a privileged situation of saying that we do already offer it. Beautiful. But we find that the number of French-speaking clients is relatively low, the people who access it. So Amanda is wondering about how can they promote that active offer among their clientele. And what comes to my mind, I don't know what comes to your mind when you hear that, but what comes to my mind is definitely what they call the signage, the bilingual intake process, having sign and having a bilingual form so that it's in your face, that their service in French. And also, it's also to offer some flexibility in that, because it's not because you are French that you understand everything as well. So maybe the person still want to have an English flyer, even if she wants a French-speaking person to talk to. So having that flexibility as an organization, and some people understand, well, if we do French, we do French. And it really has to be really centered on what the client needs and where they are at, because some people will talk but will not read. Some people are a bit shy about talking, but they need some encouragement. So
Yeah, and I will add that I will go back to what what Amanda said about there is not many Francophone clients, and don't forget the image that we presented earlier about the parking lot for the parking spot for the disabled. They never ask how many disabled people will be in this parking lot, but there is always a spot in this a spot for the disabled in the parking lot. That's the same way we should consider offering French language services. So,
indeed.
yeah.
So interesting, because that really is such a great point that you're making. Liz is asking from the Champlain CCAC, saying that they request a full designation and they are in the waiting of the process. And in the meantime, she's wondering how can they raise awareness of the active offer. Does anybody around the table have example of how they raise the awareness in their own organization, or things that Liz could do? That's Ottawa, Champlain, Ottawa.
Yeah.
I'm wondering, because we have Gilles around the table, I'm wondering if, like, the role of the health planning entity and how they could maybe support something like a CCAC to raise awareness in the Francophone community. Is there a role for that connection?
Well, I'm not sure if the question was to raise awareness within the community or within the organization itself.
Yeah, I think it could be both. Let's say both,
sure.
because we're not. Yeah.
I mean, I think often you need to think about going to where the community is already.
Yeah.
So, I mean, one can think of events, whether that is, and my colleague Amandine can speak to a number of times where she has been present at community events, whether it was a job fair or an immigration-related event, or even cultural, artistic events.
Yeah.
Because people obviously attend those events, and so it's a good way to conduct outreach. Also, the school system, I think, is a very important conduit for reaching out to Francophones. And in terms of within organizations, I think that's very important too. I mean, it's important that staff within an organization know that, I mean, even though they are not the person providing the French language service, that it's important that they know that it is provided by the organization and to whom to direct people.
That's right.
Because that can be, an organization can have, very competent staff to deliver services, but if the connection isn't being made by the colleagues who are not bilingual, then the whole system can break down, can fall down, because then, if they're not if clients aren't being referred to the appropriate places and, in a quick fashion, then it's almost as if all the effort that the organization has done to invest in having French language services can be for naught.
Yeah.
Yeah, Suzanne wants to say something.
I was just going to add in one more resource, and maybe if I could ask Melissa, if you don't mind putting it in the chat box, the connection to HC Link, because HC Link, Réseau CS, is a group of organizations that offer consultation services and community engagement supports to organizations such as the Champlain CCAC, for example. If you request a service, we can, through our group of organizations, help to support some of that community engagement through the work we do through HC Link. So it's a great resource, and I just wanted to draw your attention to it, because sometimes just having an external person come and support strategic planning, engagement strategies, possibly even help to facilitate a day, those are services that we could help with, and part of our mandate is to increase capacity of outreach to French language communities. So just putting it out there.
Great point, Suzanne. Indeed, people can access, and it's free of charge, a consultation. I also wanted to bring some resource. In the toolkit, there is a resource called Promoting in French. It's a yellow tab, and it has all the local newspaper, radio, and television, kind of more of the social media as well. And that could be a starting point to advertise your new service or to just see what's available and what can you offer from this. And remember, we don't have to reinvent the wheel, right,
No, we
Patrick?
don't have.
So I think
Not at all.
Passage, yeah.
Yeah, Passage, for example, they partner with two other organizations, the Toronto North Support Service and Francophone, three organizations, Francophone de Toronto, Toronto North Support Service, and the Canadian Mental Health Association. Those two organizations, among them, only the Francophone de Toronto is fully Francophone. But with the two others, which they are not Francophone, but with this partnership, those two others are able to provide mental health service in French for the Francophone in Toronto. That's a good example to when I said earlier that you don't have to do all by yourself, but you can partner with other organizations to offer service in French. So let's move. I think you can still continue to use the chat box to say something, but let's move with the next step, the resource. We have some resources. Hey, don't forget to involve the Francophone representative in whatever you are going to do. At the first stage of your planning process, have a Francophone on board with you. That's a secret I give you. Okay, some example of best practice. Yeah, there is also an organization called SHIP, which is has a plan, but they start slowly. The first step was to have a part of their website translated in French. And after that, they send people to Collège Boréal to learn French. And now they are becoming bilingual organization within in the Central West, LHIN. That's a good example as well.
Yeah, and it's building from year to year according to budget. That's beautiful. It's a good example.
So again, what I said before, it's you need to assess your resources, and then move from there. The next step is implement. Implement, as we saw in the target, try to implement some targeted intervention to make the FLS visible, audible, and accessible. So some questions to ask. How do I identify my Francophone client? If you remember the picture, the first quiz, nobody can say who is Francophone. It's not written on our face. It's so diverse. So we need to ask some questions to identify Francophone. How can I develop partnership? Are there any support? Where can I go for help? So we have with us here, the entities, the réseau are the LHIN. Those are good organizations to start with.
Can we name them? The other entity, usually you probably know that by heart, the name of the other entity across the province?
Well, I mean, there are 6 of them.
Okay.
And each of the 6 entities is mandated to advise either 2 or 3 LHINs.
Okay.
I mean, Reflex Salveo has a kind of a creative name. We're actually, originally we were entity number 3.
Okay.
And the others still have the numbers. So it's 1 to 6. Although in Eastern Ontario and Northern Ontario, the planning entities also wear a hat of a federally funded Réseau Santé health network.
So if somebody wanted to find and they weren't sure about the name and where is that organization, then they could always call the FLS coordinator of the LHIN.
Yes.
And it would lead to that because
Yep.
I understand that these type of organizations have did some surveys to identify the Francophone and to the organization and who's designated and who's not.
Yeah.
So you want to build on that. You don't want to do the work. When I see how do I identify Francophone client, it's so large as a question. Okay.
Yeah. By the way, there are also 14 LHIN. That's right.
Yeah.
That's correct. So, yeah, in Ontario, because there are some people outside Ontario who
are
are
participating.
online, who participate as well on this. Okay, so sample intervention, identification of Francophone passionate clients, bilingual greeting. Those are simple things that you can do. Visual identification of bilingual staff, badge pins, lanyards, and bilingual documentation and print material, bilingual signage, bilingual program names, and again, I insist, developing of partnership to facilitate referrals. That you don't have to do all by your own. Okay,
I
so
think we really like that hello bonjour from the bilingual.
from Manitoba,
Yeah.
and there is someone from Manitoba
Yeah.
in participating as well.
Did we give the link of the video from Manitoba?
Yeah,
It's a very, very
it's
good
from
one.
Manitoba. It was from Manitoba as well.
Yeah.
Yeah.
Did we share that link with this group here today?
Yeah, we can
This
share it.
video?
We can-
It's a great, the government of Manitoba has created a video that really shows using scenarios how to offer, how to, show a best practice of an active offer. So they actually have scenarios of somebody coming for healthcare services, and the first time the receptionist says, "Oh, I'm sorry, I don't speak French," and the person just has to try to get by in English. The second time, there's a very different way of handling it, where there's somebody that she can say, hello, bonjour, even though the receptionist doesn't speak French, and then she's able to say to this individual, excuse me, I don't speak French, but I will get you someone right away who does. And then she's able to connect that person to the appropriate individual. So it's a very effective video, and we'll make sure that the link is there for you.
We can send it after the workshop with the
we can send
survey.
it with the survey. You can send it
So,
right away.
We'll flag our colleague Marie-Claude to help us with this. Okay.
Yes. And in Ontario, the regroupement des entités et des réseaux, they suggested to have two questions to identify Francophone. The first one is, what is your mother tongue? That could be either English, French, or other. So the second one is, if your mother tongue is neither English nor French, in what official language in Canada are you most comfortable? And you can provide this service to these people. It's not only about French, it's about in which official language are you more comfortable. Yeah. So those are two questions to identify Francophone. So that's a good example of an excellent way to greet a client, a patient. Hello, bonjour, as Suzanne mentioned earlier. So immediately, because there is hello, bonjour, the guy can answer, bonjour, j'aimerais voir un médecin, in French. So some resources, again, are there with the RIFSO. There is a sheet from the Réseau du Mieux-être for the management and the staff, and also the LHIN, the Southwest LHIN, has good tool on how to implement an active offer. And then some promotional material could be a pin, a small lanyard, collier, key rings, and bienvenue, welcome. Those are some promotional material that you can use to show that you actively offer. Yeah, Sophie is writing something, and Sylvie is reading for me. She will summarize what Sophie is writing.
I was
in
going
a
to
few
ask
minutes.
something in between,
Yeah.
just while people are writing.
Yeah.
One of the questions that some people have said is that if we start wearing these buttons and putting up signs and saying hello, bonjour, and then there's nothing behind it, if we haven't put in the capacity somehow that we're creating false expectations for people, that people will come and they'll become very cynical very quickly because they'll say, hello, bonjour, and then there's really nothing there. So I just think that's something that we have to be very careful of. So that's why this model is trying to say that there are many components to this. We don't want to set up false expectations. At the same time, we want to create that sense of putting services out there in an active way. So I don't know if anybody has any comments on that at all, but there is a danger that we could possibly alienate people if we don't have the services that we are saying we're going to be offering. Does anybody have any comments about that? About the possibility of making a, sort of creating a false expectation?
Hi, this is Erin from Family Service Toronto. I agree. We've been working on training our receptionists in some key languages in French. We have some bilingual staff available, but we haven't put up that kind of signage yet until we've sorted out some logistics in terms of scheduling and things like that, so that if someone then follows up on the signage, that we do have someone available that can assist them.
That is a great example of moving along without just, offering everything at once and then just putting out there. I think it's not, you use the word, it's not a linear process, and I really like that. Every organization will go with what they have. If you have just a 0.5 person versus a full-time person or a whole team, it's totally different. I would like to go over to the Sophie's question, which she asked that they do serve clients in French at the moment. They do make interpretation, and we have a question for you there, sis. Are you ready? Sophie? Sophie Bart. Sophie is asking, is there any expectation from the TC LHIN that organizations who are not designated or identified do active offer for French language services? If so, I don't know if it's understood. So is there any expectation? What would be your expectation?
There is an expectation that agencies strive to have capacity French language services so that they can offer those services internally. But if they cannot, for a variety of reasons, develop resources internally, at least to get to know which other organization in the area that can offer services and have kind of an agreement for referrals.
Oh, nice.
Yeah.
So kind of the linkage between
the
organizations
linkage.
and services.
That's what we call partnership, create partnership. It could be formal or informal, but it should be handy to facilitate referrals.
Thank you.
Merci beaucoup, Sophie.
Okay.
Beautiful. So second last.
Is there anybody else on the phone? It sounded like somebody maybe wanted to say something on the phone. No? Okay, I just heard a voice.
Okay, let's continue. We are now at the fifth step, which is verify, the V. Verify what? We need to always check about if we met all the requirements. Are our clients aware of their right? We talk about active offer, but I know that now with Alveo and le réseau du Franco-Sud, they are pushing about also the active demand, because the client should know the right to ask also for service in French. So are our clients aware of our active offer? Are our clients aware of their right? They should know their right. And we should try to empower them to know the right to ask for service in French, because that's the right. So there is an organization in the London area which is wrapped around. They are working with senior immigrant Francophone, and what they are doing, they are trying to empower the senior immigrant to push them to ask for service in French. And when they don't know, when they don't have service in French, they try to connect them, to link them up with other service in French. So that's a good example of not only we should do active offer, but also we should communicate our program or initiative to our community, we should also help the Francophone to ask for the service in French as well.
Patrick, I
Yes.
just want to see the previous slide. You just said staff. You just said client, but we could say slash staff as well.
Yes.
So the staff, the clients have right, and make sure that your staff
True.
is aware of it, offer in your community. So this is an example of question, but that you pick, but there's more.
Yeah, that's a, that's a
that's
good.
just a
Yeah,
starting
that's
point.
a, yeah.
Perfect. And just before you go to the next step, Nathalie from Manitoba did share the link for the video.
Oh,
So I see that
thank you,
everybody,
Natalie.
I see everybody can access
You're
that.
welcome.
Thank you.
Okay.
It's a great video.
Yeah.
So the last but not the least step is evaluation. Evaluation. That's before thinking of expanding your program. You should evaluate. You should evaluate what do your objective has been met. How you can expand the program, taking into account your resources, and that's like any other program. You should evaluate before thinking to expand your program. That's the last but not the least step on our model, and this is what the Family Health Team Credit Valley. Here, it's an example of active offer. You can see the program, the name is in French and English, but also they evaluate their capacity, and they saw that they can accept new clients, and they put it, nouveau patient francophone accepté. So that's a process, and they can see that they still have some spot for receiving new clients. That's an example from Credit Valley in Ontario, which is a family of team.
Yes.
And the option, the night pour accéder au service en français. There is also
Composé de neuf, yeah.
composé de neuf to access service in French. So that's a good example that we show.
And I was
Yes,
just
Suzanne.
going to say, just in terms of evaluation, I think, again, this is a long journey, so that ultimately, I think what we want to be able to measure is getting back to what Tarsis said earlier, which is how does this affect patient outcomes in the long term? You know, we can maybe measure how is our active offer of service going, are people aware of it, and measure awareness indicators, et cetera. But ultimately, we want to find a way to link or to investigate whether an active offer of services has a link to better patient outcomes. And I think those are some long-term evaluation goals that we have to really look at. And I think we're at a very early stage of active offer. I think people are just hearing about it more and more often now. But I think within the next 5 to 10 years, it's really going to grow, and there will be opportunities to participate in research to really look at the connection between strengthening an active offer of service and quality of care and patient outcomes. So I look forward to that.
Yeah. So now that you spend the time to explain us the 6th part of the model, there's some condition that support that model, meaning that just going to this step without condition, it will not work.
No, those conditions are the success factors. And we put 4 here that we call forces, but it's not only those, but we think that those are the keys. The first one is commitment. Commitment at the highest level of an organization. Commitment, engagement from the management, from the board. The second key factor is
Okay, because you're going to give an example of
yeah, give me.
Yeah, go ahead.
Yeah, the commitment. A good example is SHIP. SHIP, they commit. They don't. SHIP is not a French organization. It's not even. It's an Anglophone organization. But the board are committed to offer French language services, and they started by by translating a part of their website. And they move forward a year from here, and now they are becoming a bilingual organization. In terms of competency is about training. It's about linguistic training. It's about cultural training as well. So the TC LHIN funded currently a training with La Passerelle, where they offer culturally sensitive based competencies for health provider within the Toronto Central LHIN. So those are good examples. And I know as well that Sick Kids has also a module online and still funded by the Toronto Central LHIN, where they can get access to have some information and some tools about cultural competency. Gilles from the entity, you can add something.
I would imagine that, and correct me if I'm wrong, but I would think that part of competency would be knowing what the process is. So not necessarily being, fluently bilingual oneself in an organization, but rather being equipped to know, okay, what do I do in a context where there is someone who is requesting French language services? Just, I think that's important because, no one wants to not know what to do.
Yeah.
No one wants to look stupid or look incompetent.
Yeah.
Everyone wants to know. And so I think that's important to underline for an organization where staff might be concerned about, I don't speak French, so, am I incompetent? No, it's just competency is knowing what to do in that situation, knowing clearly what the process is. And I think it's also related to commitment from the organization as a whole, so that no one's left sort of looking incompetent. Everyone knows it's clear what they need to do in the situation and how to direct people.
Perfect. I think clarity indeed brings vision, because then people know and then it's happening. In the literature review, a competency came up as a competency of the staff, making sure that some people have been trained in English, but they work in French, or they don't feel their French is good enough, so being able to access a level of personal development, professional personal development in English. And other people came from French country and feel that they need to keep up with the technical term in English because they work with it. So there's all kind of ways of developing the competency, but it's definitely about asking what is needed for organizations to be competent here, be able to offer the service.
Thank you, Sylvie, and thank you, Gilles, for this comment.
Yeah.
And the first one is the communication. Communication is, as we said earlier, we should communicate what we are doing. We should communicate reach out with the Francophone community. And I have a good example from Nexus.
Okay, Health Nexus is really moving towards the idea of more of a cultural adaptation as opposed to translation of resources that we do. So when we communicate a program, a recent example is a program that Sylvie is actually working on. It's a health promotion program for families. In English, it's called Strengthening Families, and it's for youth at risk and their families coming together over an 8-week period. And we wanted to reach out to the Francophone community and see if we could create something for Franco-Ontarians that would be appropriate. And rather than just send it off to translation and start offering the same program in French, we've really, with the help of some federal provincial funding, we've been able to really do a real culturally appropriate adaptation using an advisory group, a series of pilots across the province with different kinds of communities. And one thing that I really learned at the French Connection Forum on Friday with a wonderful presentation on marketing to Francophone communities is that there, again, back to that, there is no one-size-fits-all. We really have to begin to segment our audiences. So if we're speaking to a group of Francophones who are coming from, say, French-speaking African countries, it may be a very different, the Congo, for example, a very different messaging than, say, to somebody in Northern Ontario who has had families living in Northern Ontario for many generations. even the level of French, this is something that I wasn't as aware of as an Anglophone giving presentations in French. I'll give you just a really quick example. A few years ago, I was working on a stroke prevention project, and we were delivering some training on how to prevent a stroke to communities in Northern Ontario using the Ontario Telemedicine Network. And we had all of our training materials translated into French by a translator here in Toronto. And when I went to Sudbury to go to the OTN facility, there were people there from different communities, and we had instant feedback that our slides were using a level of French that were completely wrong for the way that people speak French in Northern Ontario. It was, really inappropriate, and somebody said, we don't talk French like that here. So I thought that was really humbling and a really important lesson. And so that idea of communication that meets the needs of the audience is really an important thing to remember. So I just wanted to share that.
Good for you.
Yes, and the collaboration, we talk about partnership, we talk about linking partners together to have French language services. And I already give an example about the partnership between the program Passage, which is a partnership between three organizations, Francophone de Toronto, Toronto North Service Support Service, and the Canadian Mental Health Association. So those are some key factors of success of any program. We already talked about those examples. So putting together all this, we have our model, which are 6 steps: access, clarify, target, implement, verify, and evaluate, and supported by those 4 key factors: the commitment from the highest level, the highest level of the organization, the collaboration, the competencies, and communication. We need to share the information with our community.
Yeah.
So that's
Okay, this is where we have space for question, comment. We want to tell you that this model is in development, so we're looking forward to have your feedback. When you work with it, please let us know how did that work for you. Let us know how you were able to apply it and what you have any suggestion, comment. We are really improving that.
yes.
And maybe we'll just open the floor to whoever wants to say a comment, or from here or from the floor, and just take it from there. So
Okay, many ways to do so. You
Yeah.
can write on the chat
Yeah.
box, or you can call, you can around the table, you can still have time to say something.
Yeah.
So please welcome.
Yeah, and we do have Suzanne also that can give us a last word if you want.
Yes, and I just wondered, I was just thinking, since we have the advantage of a colleague from Manitoba, excuse me, I just wondered, Nathalie, did you want to, because I know you have a lot of experience in this area, is there anything you wanted to share about the experience in Manitoba that we could learn from?
Oh, yes, of course, if you want. Can you hear me?
Yes.
Yes.
Yeah, okay, thank you. So I'm from Manitoba here. We don't have a policy. We don't have a law as Ontario has, so we develop a policy in which you have a plan. The plan can be a tool, used as a tool in order for organization to help them to develop active offer, which is the first steps, with signage too. And we can find the plan and the model, the government plan with a link I sent to you, which is of the government of Manitoba. So just to add with these very good presentations, I think one of the key points about communication is be able to have different level of French. Collaboration with organization as well as community is very important, and yes, it's a good first step.
Sounds good.
Great, thank you.
Yeah,
Thank you.
there is more information in the toolkit that we haven't described today, but a lot of people have interest and concern about the hiring and recruiting the bilingual staff, and there's some folders in that of information on these subjects in that in that toolkit that's made in partnership with Reflet Salveo. So it's really, really useful. We're trying to think here about what would an organization need when they want to increase the active offer, and these are the basic steps. So that's really helpful. Sophie is asking if we'll send the slide after the webinar. So yes, we will send the slide. So
And the evaluation.
the
as well.
evaluation,
Yeah,
so probably tomorrow. Tomorrow we'll proceed to that. Our Marie-Claude will do this. So you'll receive a message from Marie-Claude Gaudreau that will do that. So yes, please comment.
Also another,
Yes.
Gilles here from Reflet Salveo, another tool that will be available within the next 10 to 15 days is a toolkit that on active offer that Reflet Salveo is developing. And it'll be available online, but also we'll have printed copies available if anyone would like to see that. So I don't know if, are you able to put our website on the refletsalveo.ca? So you'll see the website address going up shortly, and that will be posted on our website. We're doing a revamped website launch in sometime in the next 10 to 15 days. So make a note to yourself to check it out in a couple weeks.
Also, next time we will visit the Toronto Central LHIN website, you will notice that under health service providers tab, onglet, tab, that we have created just below the service accountability agreements documentation that you are regularly used to check and see there. We have created a French language service section. That's where we're gonna host all these type of information tools and yeah, to help you out so that you can revisit, check it out, and send staff to see that at their most opportune time.
Wonderful. I think, Patrick, the word of at the end is yours, and Suzanne, if you want to talk about the service
as you can see on this slide.
Yeah, I was wondering if you had a glass of wine on this slide.
I think you're having fun.
Not really, but
Yeah.
I'm always happy. You can still, if you need any information, you can still send us a request at this email address that you can see there, info@healthnexus.ca. And now I thank you to everyone around the table, the participants, and I will leave the
Yes.
Yeah.
Thank you, Patrick, and merci to everyone who's participated today. I think the key message here is that this is just really a first step. This is really meant to whet your appetite for more discussion, more opportunities, and more sharing. I think one thing that we've really heard this morning is that people really appreciate the opportunity to have a chance to come to a learning table and share together. So that's something that we would like to continue in this next year. I think it's very exciting that we had participation from so many different parts of the province and also outside Ontario. That's wonderful, and I'm really, really happy to have had that input today. And I also really especially want to thank the people who have come to Health Nexus to participate in the webinar today, our colleagues from the Toronto Central LHIN, Tercis and Martine, and our colleagues from Reflet Salveo, Amandine and Gilles. And also we have with us from St. Michael's Homes, we have Ron, who has been wonderful, giving us very specific ideas about what active offer could or could not look like at the community level. So thank you so much, especially to our two facilitators today, Sylvie Boulet, Patrick Delorme, and to Melissa Potvin for doing all the technical pinch hitting and also firefighting today. It was very helpful and much appreciated. I hope everybody has a great day. We have resources here at the end, and again, you'll be getting all of these on your slides when they come to you. Wonderful resources that will help you continue to expand your knowledge and appreciation and hopefully engagement in active offer. And we look forward to continuing the dialogue together. Merci beaucoup à tout le monde et bonne journée.
Bon après-midi.
Bon après-midi.
Au revoir.
Au revoir.
Merci.